The cause of autism is a medical mystery. It's been a medical mystery for a long time. And we know that there's a heritable aspect to it, that it runs in families. So for a long time, people were quite certain that it's genetic in nature. And then the problem is that it's quite undeniable now that there is an epidemic of autism. And the number of, in the United States, for example, the rate or the prevalence of autism is now 1 in every 110 births, whereas it used to be 1 in 1,000 just 20 years ago, and about 1 in 8,000 60 years ago. And so people are asking, how can you have an epidemic of a genetic condition? So it's been something of a medical mystery. And I think this medical mystery is now being answered by the emerging science of epigenetics. And I believe that autism is not genetic in essence, but rather epigenetic in essence. I think it has a lot to do with undermethylation, which is a chemical imbalance that virtually all autism spectrum children have. And if you're undermethylated, it tends to alter epigenetic bookmarking, that is interaction with genes to determine whether they are suppressed or suppressed or promoted, turned on or off. And I think that what happens is, if this happens in the first month of pregnancy, it can have a dramatic effect on the child, and it can explain why autism brains are different, and they are different in many different ways. They develop differently, and it can also explain many of the other problems they have, and it also explains why there might be an epidemic of this condition. It's not really genetic, it's epigenetic. Epigenetic means that genetic expression is altered, changed, sometimes very dramatically, by environmental insults. So I think that's what it is. I always say that there's a Bermuda Triangle of autism. The 3 factors that seem to come together to cause it are undermethylation, oxidative stress, and epigenetics acting in concert.